Hello, my name is Dr. Dewan S. Raja. Today I will discuss about coronary artery dominance. Coronary artery dominance refers to which coronary artery provides the primary blood supply to the posterior descending artery and the inferior wall of the heart. Posterior descending artery (PDA) is also called posterior interventricular artery. And this artery also supplies the AV node. There are three types of coronary artery dominance. Right dominance in about 67 to 85% of population. The right coronary artery supplies the posterior descending artery. This is called right dominant circulation. That means posterior descending artery or posterior interventricular artery is a branch of right coronary artery in 67 to 85% of population, and that condition is called right dominance. Left dominance in approximately 8 to 10% of people. The left circumflex artery, a branch of left coronary artery, supplies the PDA, leading to left dominant circulation. That means that the posterior descending artery or posterior interventricular artery may be a branch of the left circumflex artery, that is a branch of left coronary artery. In that condition, we call that is a left dominance coronary artery. That means the left coronary artery dominance. Co-dominance in about 7 to 10% of people, both the right and left circumflex artery contribute to the supply of the PDA, posterior descending artery, also called posterior interventricular artery, resulting in a balanced or co-dominant system. So here is the image. I have taken this image from Google. Here, this is the source. This is common normal arterial pattern. Here, the right coronary artery has the branch, the posterior interventricular artery. And the posterior interventricular artery or posterior descending artery, same thing. This is the posterior descending artery. Here is the posterior interventricular branch of the right coronary artery, or is also called posterior descending artery. This is the AV node that is supplied by this. Okay. So this is normal. That means in most cases it is. There is the right coronary artery dominance. But we may have left coronary artery dominance. Here, the circumflex branch of left coronary artery continues here from the crux here as the posterior interventricular branch or posterior descending artery. Okay, like this. So that is the left coronary artery dominance. This is the right coronary artery dominance. Okay. In left coronary artery dominance, even the SA node may get blood supply from the left coronary artery or left circumflex artery. But most cases, SA node is supplied by the right coronary artery. AV node is also supplied by the right coronary artery here. Okay, left side dominance may happen when the circumflex branch of left coronary artery continued as the posterior interventricular artery, posterior descending artery from the crux. Okay, and in that condition, the AV node may get blood supply from the circumflex branch of left coronary artery. With another type of dominance in that condition, both the circumflex artery, right coronary artery contribute in the posterior interventricular artery or posterior descending artery, one posterior descending artery contributed by the circumflex branch of left coronary artery and right coronary artery. Sometimes we may have two posterior interventricular artery in co-dominance. One is contributed by the circumflex branch of left coronary artery, another is contributed by the right coronary artery. But in codominance, usually both contribute. This is the left circumflex coronary artery and this is the right coronary artery. Both unite here and mostly from here it continued okay, in left dominance. But in case of codominance, these contribute, that contribute, we have only one posterior interventricular artery. Okay, so when both the coronary artery, one by directly, another via the circumflex branch of left coronary artery, contribute in the formation of the posterior descending artery or posterior interventricular artery, then we call it codominance. Clinical significance of coronary artery dominance. Okay. So studies suggest that patients with left dominant circulation may have worse prognosis after a myocardial infarction compared to those of right dominance, likely due to the larger area of myocardium and larger mass of myocardium also, because left-sided myocardium is thicker than that of the right side, around 3 times more thicker. So larger area of myocardium at risk when left coronary system is involved. And we may have more pathology like heart failure or cardiac arrhythmia is more common in left dominant circulation. That means posterior interventricular artery is a branch of the circumflex artery, that is a branch of left coronary artery, and that left circumflex artery will form the posterior descending artery or posterior interventricular artery. Okay, so that is worse. But right dominance is comparatively better than, is comparatively good than that of the left dominant circulation. Okay, so myocardial infarction is less with right dominance. In summary, coronary artery dominance helps cardiologists predict the extent of myocardial damage in heart disease, informs decision in surgical intervention and procedures like coronary artery bypass grafting or angioplasty. So when there is left dominant circulation, the cardiologist or cardiac surgeon always take care of the left circumflex artery, because that is the artery that continued as the posterior interventricular artery or posterior descending artery. And that's all about the coronary artery dominance. If you have any question, please feel free to ask me. If you have any confusion, please don't hesitate to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice, wonderful, and blessed day. Bye now.